Hey everyone, welcome back to the channel. Today we're tackling a super important topic, heart attacks. There's so much misinformation out there, and what you don't know can be dangerous. So let us bust some common myths and get to the real facts that could save a life, maybe even your own. First up, the biggest myth of all, heart attacks only happen to old, overweight men. This is absolutely not true. Heart disease is the #1 killer of women, and it can affect people of all ages, shapes, and sizes. Young, fit people can have heart attacks too, especially if there's a family history or other risk factors like smoking or stress. So, no matter who you are, it's crucial to know the signs. Next, let's talk about those signs. You've probably seen it in movies. A person clutches their chest dramatically and falls to the floor. While severe chest pain is a classic symptom, it's not the only one, and sometimes it's not even the main one. A heart attack can feel like intense pressure, squeezing, or fullness in the chest. But it can also show up as pain in your jaw, neck, back, or arms. You might feel short of breath, break out in a cold sweat, or get really dizzy and nauseous. For women, especially, the symptoms can be much more subtle, like unusual fatigue, indigestion, or anxiety. The key takeaway here is this: if something feels really wrong, don't ignore it just because it's not the Hollywood heart attack. Myth number 3, it's probably just heartburn. This is a dangerous assumption. Yes, heartburn can cause chest discomfort, but the pain from a heart attack is often described differently, more like pressure than a sharp, burning feeling. Heart attack pain usually gets worse with activity and doesn't get better with antacids. The risk of confusing the two is just too high. If you have chest pain and you're not sure what it is, especially if you have other symptoms we mentioned, it's always better to be safe than sorry. Don't wait to see if it goes away. Call for emergency help immediately. Okay, another common one. I'm too young to worry about my cholesterol. Nope, false again. The process that leads to clogged arteries, called atherosclerosis, can start in childhood. High cholesterol often has no symptoms, so you could have it for years without knowing. Getting your cholesterol checked, even in your 20s and 30s, is a smart move, particularly if you have a family history of heart disease. Your doctor can help you understand your numbers and what they mean for your long-term health. Making healthy lifestyle choices now, like eating a balanced diet and staying active, can make a huge difference down the road. Myth number 5. If you have a heart attack, you should cough repeatedly and vigorously. You might have seen this one in a chain email or on social media. It's called cough CPR, and the idea is that it can keep blood flowing to the brain. This is a persistent and dangerous myth. The American Heart Association does not endorse cough CPR for a person who is having a heart attack. If you're conscious and think you're having a heart attack, the absolute most important thing to do is call 911 or your local emergency number immediately. Don't try to drive yourself to the hospital. Chew an aspirin if a dispatcher tells you to, but the priority is getting medical professionals on their way to you as fast as possible. Every second counts. Let's move on to another misconception. Stents and bypass surgery cure heart disease. While these procedures are amazing, life-saving treatments that restore blood flow to the heart, they are not a cure. They fix the immediate plumbing problem, but they don't reverse the underlying disease that caused the blockage in the first place. Think of it like this: if your pipes are rusting, a plumber can replace a clogged section, but the rest of your pipes are still at risk. After a procedure, you still have heart disease. That's why lifestyle changes are so critical. A heart-healthy diet, regular exercise, quitting smoking, and managing stress are your best tools for preventing another event and keeping your heart strong for the long haul. Myth 7. I'll know if I have high blood pressure. This is why high blood pressure is called the silent killer. Much like high cholesterol, it usually has no warning signs or symptoms. You can feel perfectly fine and still have dangerously high blood pressure that is damaging your arteries and your heart over time. The only way to know for sure is to get it checked regularly. It's quick, painless, and you can even do it at many pharmacies. Knowing your numbers is the first step to getting it under control, either through lifestyle changes or with medication if your doctor recommends it. Don't assume you're fine just because you feel fine. Here's a myth for the fitness enthusiasts. I exercise so I can eat whatever I want. I wish this were true. But unfortunately, you can't outrun a bad diet. While exercise is fantastic for your heart and overall health, it doesn't give you a free pass to eat tons of junk food. A diet high in saturated fat, trans fat, sodium, and sugar can still lead to high cholesterol, high blood pressure, and inflammation, which all contribute to heart disease, regardless of how many miles you run. A healthy lifestyle is a combination of both regular physical activity and a nutritious, balanced diet. They work together to protect your heart. And our final myth for today: taking a small daily dose of aspirin is a good idea for everyone to prevent a heart attack. For a long time, this was common advice. However, recent guidelines have changed. While a daily aspirin may be beneficial for people who have already had a heart attack or stroke, for many others without known heart disease, the risks of bleeding can outweigh the potential benefits. This is a perfect example of why you should never start a new medication, even an over-the-counter one, without talking to your doctor first. They can assess your individual risk factors and help you make the best decision for your health. So let's recap the facts. Heart attacks can happen to anyone. The symptoms aren't always obvious chest pain. Never dismiss chest pain as just heartburn. It's never too early to think about your heart health. If you think you're having a heart attack, your first and only move should be to call for emergency help. And finally, medical procedures and exercise are powerful tools, but they don't replace an overall healthy lifestyle. Understanding these truths is the first step toward protecting yourself and the people you love. If this video helped clear things up for you, please give it a thumbs up and share it with your friends and family. It's information everyone needs to have. Don't forget to subscribe for more health facts and myth busting. Thanks for watching, and take care of that heart.